Wait, don't scroll. If you're preparing for Nclex 2026, you need to hear this before you waste time studying the wrong way. Because a lot of students right now are celebrating for the wrong reason. They heard that something was removed from the exam and they immediately stopped studying it. And I'm telling you right now, that decision alone can cost you your pass. Stay with me, because what I'm about to explain will completely change how you prepare for Nclex. Here's the confusion. Yes, something was technically removed, but not in the way you think. And if you misunderstand this change, you'll walk into the exam thinking you're ready when you're actually missing key concepts. So let's break this down step by step. What was removed is invasive monitoring as a separate category. Now, when students hear this, they assume, oh, I don't need to study it anymore, but that is completely wrong. Here's what actually happened. It was not removed. It was absorbed into other sections, which means you will still see it on the exam, but now it will appear inside. Safety questions, critical care scenarios, clinical judgment cases, and prioritization questions. So instead of being obvious, it's now hidden inside other questions. This change is intentional. Nclex is moving away from, do you recognize this topic? And moving toward, can you think like a nurse? Can you apply knowledge in real situations? That's a big shift. Let's test your thinking. A patient is on invasive monitoring. Which action is the priority? A. Document readings. B. Assess for complications. C. Wait for abnormal results. D. Notify provider immediately. Pause. What's your answer? Correct answer, B. Assess for complications. Because Nclex priority is early detection, patient safety, prevention, not just recording data. Now watch this. A patient suddenly becomes unstable while on monitoring. What do you do first? A. Check equipment. B. Assess patient. C. Call provider. D. Document. Pause again. Correct answer, B. Assess the patient. Always patient before equipment. That's Nclex thinking. Do you see what's happening here? The topic didn't disappear. It became integrated, and that makes questions harder because now you must recognize the concept without being told directly. This is the mindset shift you need. Stop asking, is this topic on the exam? Start asking, can this affect patient safety? Because if the answer is yes, it will be tested. For my international nursing students, this is where many people struggle, because in some systems, topics are tested directly, but Nclex will mix concepts, hide answers, and test your decision making. You must train your brain differently. Let's go deeper. Patient with invasive monitoring shows abnormal reading. What is your first action? A. Document. B. Reassess patient. C. Ignore if stable. D. Notify provider. What's your answer? Correct answer, B. Reassess patient. Always verify before acting. Patient comes first. Use this rule every time. Removed equals integrated. Integrated equals still tested. Still tested equals must understand. If it impacts safety, Nclex will test it. So, don't fall into this trap. Nothing important is ever truly removed. It just becomes smarter testing. Be honest. Did you think this topic was gone? Or were you still studying it? Comment below. If you want to fully understand these changes, especially as an international nursing student, you need updated strategy, not old study methods. Pass your next exam using RN and LVN refresher online help from Gab-Nic Excelsior Nursing Tutoring Center. Go to my profile, tap the link in my bio, select RN refresher. Inside, you'll get updated Nclex breakdowns, case-based learning, and step-by-step strategies. And don't forget, check my description on YouTube for full lessons.
Profile. Once you're in, select the RN refresher course. You'll also find a weekly timetable to help you study consistently and stay on track. So you don't feel overwhelmed while studying, revisit important topics. It's not just about studying harder. So if you're ready to improve your understanding and stay consistent,